Welcome to the Caregiving Podcast. I'm Inga.
And I'm Julie.
And long story short, we have Caregiving. We are two momtrepreneurs who have built an in-home care business from the ground up, guided every step of the way by God's care and fueled by agape love. Almost 14 years later, we felt called to create this podcast as a resource for families with caregiving needs. Whether you care for a family member or are looking for advice on professional caregiving, we want this to be a platform to support you.
Each week, we will come to you with encouraging stories of families who have found the right balance for their loved ones, tips for how to care for them and you, and much more. We hope you continue to join us each week as we share in this exciting new journey together.
Hello, sunshines, and hello, Julie. Wakey, wakey. We're recording pretty early in the morning for us.
Yes, that's bright and early.
Yes.
Yeah.
So, hey, how's your creepy skin?
My creepy skin. Pretty good. I have a daily moisturizer thingy I do with just lotion because, that's that low maintenance thing. Yeah. But, I do have a itchy back occasionally, but I've got this handy dandy little thingy. It's about this long. It's a wood thingy with a little hand at the end.
A back scratcher?
Oh, that, yes. And you just get going and it
So
here's what ails you.
When Bailey was little, she called him a back thatcher.
Oh.
Yeah.
It's that or the edge of the door.
Oh, yep. I've done that too.
Yeah.
I don't know why I'm holding onto the microphone. I think it's stable.
I'm very scared today.
Yeah. So those things, I would give them out actually as in stockings, as stocking stuffers, because once you experience a back thatcher, it's really good to have around.
Well,
especially
I'm wondering
when,
why I haven't gotten one from you.
Oops.
I'll put
that on your Christmas list.
I think I actually had gotten one for Mike and then I promptly stole it back.
Oh, perfect.
So I've got one, but one of the fingers is gone. So it'd be cool if I got a new one.
Good to know.
Yeah.
Good to know. What's the next holiday coming up? 4th of July.
Yes.
I mean, we could start a new thing.
Yeah.
Do some gifts for 4th of July, huh?
Yep.
Okay.
Yeah.
Well, anyway, enough about that. Anything else, Julie, before we roll into our verse?
I think that's enough. Yeah.
Certainly enough. Okay. All right, you guys. Well, today the verse that we have for you is actually Proverbs chapter 16, verse 31. And it says, "Gray hair is a crown of glory. It is gained in a righteous life." Yes. You may not see it or you may, but it's there. I have my girl Casey who keeps track of me.
Yeah. Well, I had a hair catastrophe this week.
Oh, you did, didn't you?
Yes, I was scheduled to get the old coloroo going and had it canceled at the very end. So now I can get in next week.
Oh.
So that's bad because I had podcasting to do. I have a wedding to go to this weekend and I can't look great. Even though the Bible says that it's a good thing, I'm not quite ready to go there.
I tried to grow up my gray hair like I tried to dye it. 2 days, and I'm like, well, that's enough of that.
Some people look so incredibly beautiful as they just go natural, and it turns into this beautiful. But I know. I just can't quite yet.
I know. I'm there too.
But then what am I saying? I got a 94-year-old grandma that still colors her hair. I'm coming by it naturally.
Yes. I have a mother who has never colored her hair. Not once that I know of.
Wow.
We talked about it. We had a plan one time. We were going to try it, and I'm pretty sure she chickened out.
Wow.
Yeah.
If only.
If only.
Yeah.
Well, she's one of the ones that it looks really nice on.
Right. Yeah. No, mine comes from the Jackson side.
Mm-hmm.
White. White as snow if I didn't do my hair.
Huh.
Yeah.
All right. Well, you do have that appointment scheduled then.
I think I do. I better check.
Okay, perfect. What's your good news story?
Oh, it's just the cutest thing. And it's not because it's annoying as heck, but it happened to me yesterday, but not the same, but I'll explain. So anyway, in Washington, because at first when I heard this little blurb, I thought it was like in Australia, but in Washington, somebody had taken their baby wallaby. Oh, which is a baby kangaroo. Well, not a baby kangaroo, a different kind of the kangaroo chain.
Kangaroo looking thingy.
Much smaller.
Okay.
So somebody in Washington has this wallaby as a pet. and they keep their truck going. They run in to grab something, and the stupid thing locks the door.
Uh-oh.
So they had to go through the whole rigmarole of getting the fire department there to jimmy it open, and because that was a naughty wallaby.
That's funny.
But then yesterday when I took the cow to processors, I took Margot with me, the husky.
Yes.
And at least I was smart enough to take my keys with me, because I was like, she's going to be jumping all over the front there. And what if she locked that door?
Oh, I know.
So thankfully, because I went not once, but twice, because I had to get in and out a couple of times and jimmy things around. And so Margot was my naughty wallaby. But it was actually very surprising to the Washington firefighters when they thought it was just going to be like a Margot or something. And here it
just
was.
a run-of-the-mill
Here it was
car.
a kangaroo.
That's funny. I thought you were going to say they came back out and the wallaby had driven away.
Well, gosh, if they weren't careful, it could, just depending on where, it could just kick it into gear.
I know.
Ooh.
It's kind of scary
Yeah.
to think about, but well, that's cute. I'll have to look at the video.
Yes.
Well, mine is a little story about some divine intervention, I guess you could say. So 2 security guards, they are being hailed as heroes after assisting a mother whose infant son was choking.
Uh-oh.
It was just before noon that Joey Madrigal and Nico Nesbitt pulled into a gas station at a busy Beverly Hills intersection and saw a scene unfolding before them. A mother with a baby in her arms was screaming if anyone was a doctor, and Nesbitt, who was a former Marine, rushed to help despite the fact that he wasn't a doctor. Before he knew what was happening, the mother practically threw the baby into his arms, and he then convened with his partner, and they noticed that the infant's face was turning blue. So immediately he flipped the baby over, started patting on the back to clear the airways. And basically, this is quoted from Madrigal, who was the second person. Then he tells me the baby isn't breathing. Right then and there, I turned. And one thing that I've learned through training and everything is that you have to slow down time. You've got to realize and just get all the facts, put it all together, because he was pretty much in charge of the rescue at that point in time. And that's interesting because so many times we go into those situations and you panic, you react, you don't take a second to slow down, get all the information. So it was pretty quick thinking on these guys. Turns out they were actually private security guards for a company that's called Covered 6. So they were Madrigal was able to use his own private line into 911 or something to that effect.
Wow. So
it sped up the process significantly. And Nesbitt just said it was the best feeling to feel that way, to assist a community, especially a little child. That's amazing. The whole incident was captured on the station security camera, so I'm sure we'll put it on the show notes for you. Mm-hmm. And the 2 men are being hailed as heroes whose quick and decisive actions saved the baby's life. And they both basically said that they strongly believe it was divine intervention, that they saw that and arrived on the scene at the very moment that they did.
Good grief. So did he swallow something?
I don't know. I'm not sure what the choking was, but
wow.
Yeah. So these guys just
lucky baby
happened to be right place, right time, and jumped into action.
Huh.
Yeah. Cool.
Yeah.
All right.
Wowzer.
Well, listeners, if you have any verses you'd like to share with us, any good news stories, quotes, anything, we'd love to hear from you. Email those to the caregivenpodcast@gmail.com.
Yes. Yes.
And today we are going to be talking a little bit more. So we did a couple episodes ago, we talked about, sunscreen and things like that, but we're actually going to get into some more on aging skin in the elderly. And
yeah, we were kind of talking about from here up.
Right.
Now we're going to go from here down.
Perfect.
That.
So there will be no excuses for you people out there.
We got you covered. Head to toe.
Head to toe. You got it.
Okay, so basically what you need to know about aging skin, let's just start there. Mm-hmm. And so basically, first off, you got to know what you're in control of and what not.
Right.
In life, it's about change. Skin is proof. How your skin ages depends on such factors like your lifestyle, diet, heredity, and personal habits, including your self-care routine. Mm-hmm. Oh, no. To better understand what causes the skin aging and what you can do and can't do, there was talk with a dermatologist, and this is kind of a summary of that discussion. So the visible signs of aging, it's different for everybody. Rough, dry, itchy, slack is the loss of the elastic tissue, the elastin and collagen in the skin, which with age causes your skin to become slack and hang loosely. Transparent. This is caused by thinning of the epidermis, which is the surface area of the skin, and the dermis, the deeper layer of the skin. When your skin becomes fragile. Increased skin fragility is caused by flattening of the area where the epidermis and dermis come together. More easily bruised. This is caused by thinner blood vessel walls and more prone to developing skin lesions such as non-cancerous tumors.
So hold on a second. Farm Mama Fitness with the bruising stuff. How many times do you look at your poor body and go, how'd I get that one?
I do just about every day.
What's really funny last night with Kevin and Bailey, they both have the same bruise on the same arm, and it happens to be from treadmilling of the lambs, and they're like, oh yeah, that's what that's from. But it was just hilarious because and then me, of course, I'm like, oh, does it hurt? I'm poking the bruise. I learned that from Kevin, by the way.
Oh, that's hilarious. Yeah. Bailey just got a real nice recurve bow. And I remember in 4-H when I learned how to do a bow, and the biggest thing they said is keep that arm straight.
You don't want to
and I did not. So I had a bruise from here to all the way down.
Yep.
But anyway, all of these things we were just talking about, we see it in all of our clients.
Yes.
We see
one or multiple of those.
Yeah, and skin tears and all of that. We're going to go into that, but it's definitely a thing as you get in your advanced age.
Yeah. So basically what below the skin changes that causes what's seen on the face, right? So skin across your body isn't the only place it changes. Aging skin can also change the appearance of your face. We talked about that, like you said. Don't be alarmed, but basically some of the factors include that loss of fat below the skin, or what the dermatologists call the subcutaneous layer in your cheeks, temples, chin, nose, eye area. That can result in loosening the skin and kind of a sunken eye situation. Bone loss may become evident after age 50 and cause slack skin and puckering of the skin around your mouth. And then cartilage loss in the nose actually can cause drooping of the nasal tip, which makes the bony structures in the nose easier to see.
Oh,
isn't that wild?
I didn't know that. And then also I was thinking about bone loss around your mouth. So I don't even understand. Just your mandible, your jaw, and all that.
I feel like I've seen your face like that recently.
I know. I don't know what it is about podcasts, but I have to squish my face. But I'm just envisioning the bone loss, and maybe it's even up here where it doesn't hold the skin up like it was. So many things to ponder.
Yes.
I am pondering.
Ponder away.
Yes, I will. How does sun cause aging of the skin? And that's that photo aging that we were talking about a couple podcasts back, where overexposure to the sun does enhance aging to your skin. So get out your floppy hat, like Cheryl said.
Yep. Hey, I just got sunglasses. They're pretty big. The lenses are pretty big on them. I'm excited because with prescriptions, so I don't know why, but this is the first pair of sunglasses that I've had that are prescription sunglasses that I don't feel like I'm in a fun house. Honestly, they're always a little distorted. But I was super excited because it's covering more area. And I can see better.
So you don't have to wear your glasses under your sunglasses because they're prescription.
They're prescription, yeah.
I need to see these things.
Yeah, I'll show you later.
I'll just check out your spectacles.
Yeah.
The skin also bruises and tears more easily and takes longer to heal. I mean, how many times do we have to have or we come in and somebody's got a big old Band-Aid?
Yes.
And
yeah, it's remarkable how many of our clients will have something happen and then it's weeks, months, sometimes more to get things healed up.
Well, and just like anything, you get an owie, it just seems like that's where you keep bumping yourself.
Always.
And it never gets to heal because you're just still bugging it all the time.
Like when you bite your lip.
Oh.
And then just keep biting it.
Oh, I hate that. Yeah. So while sun damage may not show when you're young, it will catch up with you later on. Yeah. Though you cannot completely undo sun damage, sun skin can sometimes repair itself. So it's never too late to protect from the sun.
And always remember that SPF 30 or higher and broad spectrum for sunscreen.
Righto.
So other factors that can cause changes to your skin, well, Gravity. When the skin loses its elasticity, gravity causes that drooping of the eyebrows, eyelids, looseness and fullness under the cheeks and the jaw, which is the jowls and the double chin that we have going on here.
Talking about.
And actually lengthening of the earlobes.
What?
Yeah. Obesity, excess weight causes skin to stretch and decreases the strength and luster of hair and nails.
Nails?
Huh. Interesting. It can also cause skin conditions, including dark patches on the skin, growths that stick out from the skin, and stretch marks and varicose veins. So there are just other things, unfortunately, that go along with obesity and have been linked in terms of skin conditions like psoriasis, cellulitis, things like that. Also, it can actually, your daily facial movements can cause changes. So I get like locked up and really tight in my jaw here. And actually on the way to work this morning, I'm like feeling it. And then I'm feeling this side, and this side is definitely more powerful, like the muscle. Oh, well, I think it's because I chew on this side.
Oh, interesting.
Would that be a thing?
It could be definitely a thing. Yeah.
Okay. Yeah. So laugh lines are sort of real. Lines on the face become more visible after the skin starts losing its elasticity, usually as people reach their 30s and 40s. Lines may appear horizontally on the forehead, vertically on the skin above the top of the nose, often called 11 lines, or as small curved lines on the temples, upper cheeks, and around the mouth. So there's different areas do different things with the lines.
Often called the 11 lines.
Yep.
So
it's skin above the top of the nose, often called 11 lines. Is that like right here,
I've got
in
like
between your
45
eyebrows?
right here.
Is it in between your eyebrows? If it's
And
at the
up?
top of the...
Yeah.
I don't know. We'll count later. We won't put the people through it.
Yeah.
Sleeping position. How you sleep can play a role. Sleep creases are commonly seen on the side of the forehead, starting above the eyebrows to the hairline near the temples, as well as the middle of the cheeks. These result from the way the head is positioned on the pillow and may become more visible after skin starts losing its elasticity. Changing your sleep position may improve these sleep creases and prevent them from becoming worse.
I should be good there because I toss and turn.
You can even fail at sleeping?
Yes.
Good grief, Gertrude.
Yeah, but I toss and turn, so.
You're good.
And I also use a different pillow all the time.
Oh, how?
I grab whatever's closest and just get comfy. And
I
then
am the princess in the pea.
Yes, you are.
I cannot. Like, I'm leaving today to go see Sam, and I will not take clothing items if it means that I can fit my pillow in my...
I already teased you about your pillow.
I know.
I was like,
I know.
If you didn't have to take that pillow, you could sure fit a...
Poor Sammy would get a birthday present if you didn't have to take your dumb pillow. Yeah. I don't know. So I applaud you. I cannot sleep on, it has to be my same pillow.
Oh.
And then it's one of those ones that almost looks like a candy cane.
Oh, yeah.
And then when I wear it out, because eventually you wear it out, then I have to start over. But then it's not as good when it's brand new because it's too stiff. Yeah. So it's a real thing in my house.
Yeah, smoking. People who smoke tend to have more wrinkles than non-smokers of the same age, complexion, and history of exposure. The reason for this difference is unclear, but it may be that smoking interferes with normal blood flow in the skin.
Yeah. Dry and itchy skin. Dry skin is common in later life. About 85% of older people develop a winter itch because overheated indoor air is dry. Oh. The loss of sweat and oil glands as we age may also worsen dry skin. Anything that further dries the skin, such as overuse of soaps, antiperspirants, perfumes, or hot baths will make them worse. Yeah. But dry skin itches, basically, dry skin itches because it's irritated easily. If your skin is very dry and itchy, this condition can affect your sleep, causing irritability. Sorry, I'm just thinking about all the things that make me irritable. Sorry. It could be a symptom of a disease. For example, diabetes and kidney disease can cause itching. Some medicines may make that itchiness worse. In that case, be sure to see your healthcare provider to see what the cause may be and any potential treatment possibilities.
Well, I'll tell you what, there's nothing worse than having an itch that you can't get to. I just happened to notice that 'tis the season for mosquitoes. Oh. And the other day, one got me right on the top of my foot.
Ooh.
And I was in a position at that point where I could not scratch.
Oh.
And that's all I could think about.
Yeah.
And then the other day, I think I got one on both elbows.
Mosquito bites.
On my weenus. Is that what that's called, right?
Uh-oh.
It's a technical term.
I heard a big sigh from Alyssa. But I think it actually is.
Yes.
The weenus, right?
Of your elbow is your weenus. And when you get a mosquito bite on it, it's itchy.
Yeah.
So that is what is relevant to then the podcast.
Perfect.
There you go.
Way to tie it all together
You
for
know,
us.
that's what I do. It's
Appreciate
magic.
it. Yes. All right, let's talk about some common skin conditions in elderly adults.
Righto.
Okay, like every part of the body, the skin changes with age. The teen years bring dreaded pimples. Middle age brings telltale wrinkles. In elderly adults, skin conditions become more numerous and more noticeable as the skin continues to thin, lose fat, elasticity, and moisture. Yeah. So skin cell turnover decreases dramatically, which slows wound healing. Aging weakens the immune system, so skin infections are more common. Age spots may take up more acreage, and large dark bruises may spring up out of nowhere.
Righto.
Yeah.
Yeah, so you don't have to be out working sheep or cows to get a bruise.
You can just be thinking.
Yeah.
You can just be sitting in your chair reading a book, and all of a sudden a bruise pops up.
Oh, boy. Yes. So easy bruising. Why do older people bruise easily? Because aging skin is thinner and there's less fat to act as cushioning. Also, blood vessels are much more fragile and easily broken. Bruises happen when blood leaks out of the blood vessels, so more broken vessels means more bruising. Older people who take blood thinners or even over-the-counter pain killers such as aspirin or ibuprofen may bruise more easily. A minor bump or scrape will result in a surprising amount of bruising and make concerned ones, loved ones wonder what's happening.
Oh, yeah.
We see that
Yes,
a
lot.
Oh,
Like,
yeah.
what happened to this individual?
Yeah, because you're always worried that, oh my gosh, did she fall?
Yeah.
You know, or anything.
Yeah.
There's your mind just goes crazy on those kinds of things. They're usually harmless, but anyone who develops large bruises with no logical explanation should see a doctor to rule out an underlying health problem.
So dryness and itching, we talked about that just a minute ago, but basically it'll give you some things to take action on if you have that dry, itchy skin. So take shorter, cooler baths or showers and use a moisturizing soap. It actually says to skip the deodorant soap. Use a moisturizing ointment or cream daily. Apparently, it says to avoid lotions, which can contain more water. CeraVe, Cetaphil, and Vanicream are all super gentle, effective moisturizers. Drink more water. Always drink more water.
Yeah.
And then also you can run a humidifier if the air is dry.
Right.
And then, of course, if you do not get any relief from those types of things and you just can't get that itching to subside, it might be something more serious, liver, kidney, thyroid, something like that. So you would want to check with your physician.
Gotcha. Age spots. And I worry about age spots because I already have freckles.
Right.
So I'm wondering, are they all just going to bleed together? And then I'm just going to have
one giant age spot?
One big old age spot right here. So we'll see. Time will tell.
We're both just giant age spots, Julie. Let's be real.
Skin in older adults is often dotted with age spots due to years of sun exposure. These flat tan or dark brown spots, which some people call liver spots, typically show up on skin that's gotten the most sun, such as the face, the arms, and the back of the hands. They're harmless. So once again, to take action, sunscreen, floppy hats, all of those things.
Yeah. Skin tags. Skin tags are the soft, spongy, like they usually are flesh colored, tiny little growths of tissue that typically appear on like eyelids, neck, thighs, skin folds, such as your armpits, groin, or under your breasts. They actually may hang from your skin in kind of small stalks. Skin tags are more common in women, people who are overweight, older adults, and people with diabetes. They can become irritated if clothing or jewelry or anything like that snags on them, but they are harmless. So if they're not bothering you, they're fine. If you do want to see about getting something removed, that would be going through a dermatologist, but don't try to do it yourself.
There's stuff though at Walmart that says skin tag removal.
Yeah.
And
maybe they mean don't try to rip it off yourself or something.
Well,
I don't know. I'm sure it's someone out there has tried.
Oh,
but yes,
obviously.
I do see I see advertisements for
that is why
skin
we have
tag removal.
all of the stupid warnings in the world.
Yes.
Because somebody obviously did the stupid thing.
Yes.
Skin cancer. In old age, melanoma rates spike. Slower growing basal cell and squamous cell cancers also become more common. In addition to more years of sun damage, older adults have a decreased ability to repair precancerous cells. Age is the strongest risk factor for non-melanoma skin cancers. So basically do a skin check every month. Yeah.
Yeah. Shingles. Okay, so adults, we've talked about this in the past, but adults who have had chicken pox as a child are vulnerable to shingles as adults. So, and unfortunately, older adults are particularly more vulnerable. Shingles start with burning, itching, tingling, or extreme sensitivity in one area of the skin. A painful rash then develops, often along with a fever or a headache, and the rash eventually will blister. Skin infections and long-term nerve pain are possible complications of that. So the way to take action on that is the minute that you start to experience any symptoms or anything appears, make sure that you get to your doctor on that. Because early treatment with an oral antiviral medication might reduce the duration and severity. And basically, you can also take over-the-counter pain medication and use cool compresses, something like calamine lotion and lukewarm baths with colloidal oatmeal for itching, if it's causing itching. Why are you laughing? Just, okay. And then there are some vaccines out there that you can take to help in the prevention of shingles. I don't think it's 100%, but.
Yeah, no, shingles are bad. They are painful for those that have said they have had it. Yeah. Bed sores. Boy, that's something we battle every day, every single day. Bedridden or wheelchair bound older adults are susceptible to open wounds called bed sores or pressure ulcers. These develop in areas subject to pressure where you sit or lay down, such as the tailbone, shoulder blades, backs of the knees, and heels. Poor circulation or poor nutrition, or people with diabetes face a higher risk of bed sores. And so prevention is critical. And I have had a poster before that showed all of the stages of bed sores. And then like stage 10 is that deep, terrible wound. And we actually had a client that came to us who had already been at that very end stage. And it was horrendous because it was just so painful and it hurt so bad. And everything and anything would, get in there for infection. And it was just something that she could never recover from. So what we do is when we're helping somebody potty, or if they're in bed and we're turning them every 2 hours to put positions them in different ways, put pillows and all of that. And basically we're looking for skin redness because there are some salves and some different things that you can put on there that are barrier creams. And they're just vital to get. I mean, anytime you start to see any of that red, you've got to get on it now.
Prevention is the most important.
And it's shocking. A lot of this stuff comes from places where you've just been in bed, so if you come from the hospital, make sure you check yourself. Anytime you sit in your chair a lot, you've got to pay attention to redness. And unfortunately, my biggest fear is that at some point I can't check my own butt and I'm going to have somebody look at my butt for red marks. Sorry, whoever that may be.
Oh, I know.
Can you even imagine? Rough. Here, check out this beautiful moon. Is it red or is it blue?
Volunteer anyone but me.
Is it just that glorified white? Full moon, baby. Skin tears.
I can't even with you, Julie.
Moving on. Skin tears. Why don't you talk about those?
Oh, yes. Let's do it. All right. So the fragile skin of elderly adults tears more easily, right? And this is especially in people that take oral or topical corticosteroids, and those can weaken the skin. So skin might tear when you bump into something, or even when a caregiver removes like wound tape or dressings.
Ouch.
Yes. So it can happen very, very quickly, very innocently enough, but it's a big deal. So take action. You do that by using moisturizer and drinking plenty of water to keep your skin hydrated. That's going to help prevent those tears. Wearing long pants and long sleeve shirts or arm sleeves to protect the skin if you can. And if a small tear occurs, make sure that you wash the wound with gentle soap and water, put the skin flap back in place if you can, then cover the wound with gauze. See a doctor for more serious tears, or if you notice signs of infection, that would be things like redness, swelling, fever, worsening pain, or a bad odor. Yeah. So take those seriously because a little tiny skin tear can turn into a big old problem.
Big problem fast. Yeah. Not good. So what we're going to kind of wrap up here with is 6 most common skin conditions after you turn older. Let's say 70-ish.
Okay.
Yeah. Yes.
I'll let you do the first one because I can't pronounce it. And it's more fun to watch you try.
Good lordy. So the good news is that the 6 most common conditions affecting people 70 years and older don't necessarily need medical attention. But the first one is seborrheic keratosis.
Perfect.
Thank you. It's a non-cancerous wart-like growth that often appears on the face, chest, shoulders, or back. Typically, they are slightly elevated from the skin surface and appear as waxy brown, black, or tan growths. No treatment is necessary, but if this does come up, it does cause irritation. And if it does cause irritation, then you see your doctor. But also, the biggest thing, like with skin cancer, is you're supposed to, if there's any growth or notices uneven edges, all of that. So see your doctor to make sure it is one of these thingies. Seborrheic keratosis.
Perfect. Okay. Lentigo senilis.
Yeah, see, that one's
I don't know. You just got to go at it with confidence, whether you're pronouncing it correct or not. Okay, so older adults, people with fair skin and people who have spent a lot of time in the sun are the most prone to this lentigo senilis, more commonly known as liver spots. I should have led with that. They appear as flat, tan, brown or black spots, most often on the face, hands, shoulder, and arms. It is important, however, for your doctor to distinguish between an age spot and other conditions, such as lentigo maligna. This is a type of skin cancer. Liver spots are harmless and don't need treatment, but in some cases, prescription creams and procedures can remove them or at least make them less noticeable.
So, question. Why are they called liver spots?
I don't know.
I'm going to have to look it up, but my guess,
yes,
and it's very, very intellectually thought out.
Oh.
No.
Oh, sorry. Intellectually thought out. Yes, of course.
It looks like a liver. It's just kind of like, it's just hanging out there.
Okay.
And it looks like a liver. Have you seen a liver? They're just kind of disgusting.
Okay. That's very well could be true.
I'm going to have to look it up. Cherry angiomas.
Oh, good thing you got that one. I wouldn't have pronounced it right.
Oh, I did. Are non-cancerous skin growths made up of blood vessels that give them a reddish appearance. They are fairly common skin growths that vary in size from a pinhead to a 1/4 inch in diameter and usually show up after age 30. They appear smooth and even with your skin, while others appear slightly raised. They can bleed if scratched, rubbed, or cut open. Once again, talk to your doctor if you notice any changes in appearance. I actually have one of those. And I actually went to the doctor because it was all of a sudden out of the blue. I had this thing up on my shoulder. And every time I put on my brassiere, I would...
Brassiere?
Bra. Anyway, I would catch it. And when it was brand new, it just like, it bled. It was disgusting. And so I had a Band-Aid on it like all the time, which is also annoying. And so I went in and they just looked at it and go, oh yeah, that's okay. Here, give me $100.
Oof.
Yeah. But good news. It's nothing serious. And it quit catching on my brassiere.
So you just have one?
I do.
Oh, so I have those little red pinpoint things all over.
Uh-huh.
Yeah.
Yeah, mine is actually raised. That's why it was catching on stuff.
Got it.
And it had come on so suddenly. And it was after a weekend of being in the sun. And then all of a sudden I saw it. I was like, oh, I better get this checked because this is the situation, you know. Yeah. And so I was able to get into a dermatologist and told I was a big baby.
Get over yourself.
$100 and go away.
Thanks and have a nice day.
Yes. But I have peace of mind now.
Perfect.
So there you go.
Yes.
Yeah.
All right. Number 4, I'm not even going to try to pronounce, but I will just tell you that it's a mole.
It's a mole.
Yep.
But the mole word actually is this long.
Yes. So just a common folk like myself is going to recognize it as a mole. So that's what we're going with. They're the small pigmented spots on the skin that usually appear during childhood or adolescence. The number of moles will vary by person from a handful to hundreds. Typically, they have clear-cut edges and are uniform in color. They can darken or enlarge during adolescence or pregnancy. Most moles are harmless, but they can, on a rare occasion, become cancerous. So it is important to monitor them. See a dermatologist if they get larger suddenly or develop an irregular border, become darker or inflamed, show spotty color changes, or begin to bleed, crack, or itch, or if they become painful. So I'm like you, I will sometimes catch something. Actually, when I was younger, I had one on my neck, a mole that was pretty significant, and it caused a lot of issue with like my collar or necklaces and things like that. So I actually did have it removed.
Oh, really?
Just at the local doctor's office.
Yeah.
Back when they could do stuff like that, and it didn't have to be a
specialist.
Specialist. So
yes, but there is a difference between moles and freckles, which is just pigmentation, which I've always been told they were angel kisses.
They are angel kisses. Both my girls have lots of freckles.
Yeah, mine too. Oh, and then of course, what the next one has got to do with feet, and we know that's my favorite.
Just pause for just a moment while Julie composes herself to talk about feet.
Well, see, and this is not right. Tina Petus on your
just go with the common name
on your fetus. Athlete's foot. There, I can handle that. A common foot infection caused by fungi called dermaphytes. Whatever. That thrive in warm, moist environments. Gross. Symptoms include itchy feet, cracked, blistered, or peeling skin between the toes, or redness and scaling on the soles. You got to be kidding me. The infection can also spread. Oh, no, I can't even. You stop.
Okay, I'm so sorry. Okay, infection can spread to the toenails, turning them thick and cloudy yellow. And it can take months for athlete's foot to respond to treatment. Once someone has been exposed, it's easy for the fungus to return. Ugh. So over-the-counter antifungal medications are recommended, but if those don't work, you need to talk to your doctor. People with diabetes easily get skin infections, so they should see a doctor as soon as anything unusual appears on their feet as well. So, are you okay?
No,
I'm
not.
Okay?
I'm not. I was doing great, and then all of a sudden we had to talk about Tina's petus. Whatever it is. Tanea, whatever, athlete's foot. Oh, God bless nurses like Margaret.
Oh, yeah, who willingly goes out.
Willingly, on purpose, will go and clip people's toenails.
Yep.
My husband asked me the other day, he goes, will you clip my toenails? Because he just wanted a response, and he promptly got one. And I said, no, I can call the horse farrier for you, though. Girl, roast me out. Okay, I got to recoup.
But were you okay with baby feet? Like when your kids had their little toenails growing and had to clip those? You're not grossed out by that, right?
Were you supposed to do that?
Oh, you never? Okay, maybe not.
Maybe that's why they still walk funny.
All right, fair enough.
Just kidding. Yeah, baby feet.
Oh, that's not as gross.
No.
Okay.
No.
Rosacea.
Yes.
More common among fair-skinned women, rosacea causes redness and visible blood vessels, usually on the face. The skin condition can be mistaken for acne, other skin problems, or natural, like, rootiness. Mm-hmm. It is a relapsing condition, which means that there are periods when symptoms are particularly bad and times when they are less severe. The cause is unknown, but it could be due to a combination of hereditary and environmental factors, and that's according to the Mayo Clinic. Oh. There's no specific test for rosacea, but you may need further tests to rule out other conditions with similar symptoms, something such as lupus. So creams, gels, oral medications, they can help reduce the spots and redness from rosacea. If you have the condition, the Cleveland Clinic actually advises that you avoid common triggers such as alcohol, spicy food, and stress.
Oh.
Yep. And then also basically it's recommended by the National Institutes of Health to use like a pH balanced skin cleanser rather than soap. Use moisturizers regularly and apply that broad spectrum sunscreen, 30 proof or higher.
Speaking of sunscreen and skin moisturizer, I listened to Our Own Words.
Yes.
And I sent you girls a picture the other day where I was at the pharmacy and I actually had to buy new face stuff anyway. Yes. So I didn't know what to do. So I bought two of the little ones, one with the peptides and collagen and one with the vitamin C.
Good girl.
So now I'm just like, which one do I feel like using today?
Oh.
So I dab.
So you're dabbling in
my
dabbling in skincare.
Yes.
Perfect. I love it.
Yeah, that's where people go off mad because they WebMD'd themselves and now they're just
dabbling.
Messed up and they're just dabbling.
Yes. Well, there you go, people. That's some common skin conditions you have to look forward to.
Yeah, itchy, scratchy.
Do you know we have a barn cat named Scratchy Bitey?
Oh, no.
Yeah. The cat just showed up a couple years ago, just out of nowhere.
Oh.
It used to sit out in the field and just watch us, and then it would come a little closer every day.
So bad after all.
And then, and then eventually I don't know if it's a boy or girl, but it decided to live at our house in the barn, and so we feed it. But it got the nickname Scratchy Bitey, or the name Scratchy Bitey, because it's kind of scratchy and kind of bitey.
Oh yeah.
Like when niece or nephew Todd's wife Carly was helping with chores, the cat he'll kind of swipe at you. He'll give you a little love bite. He always knows, or she always knows, it's not the right decision to make, because there's always a lot of remorse afterwards, at least with me. But most people just avoid Scratchy Bitey, and I'm like, oh, come here, kitty.
Yeah, you're
Let me hold you. And I'm grossed out the whole time, because it's just a barn cat, and it's just kind of.
Barn cats need love too.
Oh, they totally do. She's got long hair, and so
yeah.
it gets all matted. So I'm constantly cutting mats out, and she's got teeth that go in opposite directions.
Oh, she's pretty.
Yes, but I love that cat. She'll climb up my leg, and everybody looks at me like I'm a weirdo, which they're not wrong. But
yeah.
Anyway, so Scratchy Bitey, itchy itchy, scratchy scratchy. Whatever.
That kind of summarized our day.
Yes. So what's your grandma saying?
Less said, sooner mended. So this one's debatable.
Okay.
But we're going to analyze it.
Perfect.
Okay. Another of Ma Ingalls, who's from the Little House on the Prairie.
Yes.
Her old saying is, if you find yourself in a messy situation, you can cause yourself more heartache and harm if you keep it stirred up. Mm-hmm. Let it alone, and it will die a natural death. So there's a difference between dealing with it, moving on, or just putting your head in the sand and thinking it's going to die its natural death and move on. Because some things don't.
Yes.
It only gets worse with quiet. But Ma Ingalls can't be wrong.
Righto. No, I kind of interpret it like, hey, when there's an issue, you address it and then you move on.
Yeah.
And don't keep that spinning cycle.
Spinning the pot.
Like social media, right?
Stirring the pot.
Stirring the pot.
Yeah.
Just address and move on instead of continuing to perpetuate
and
it.
I should less said, I don't know what that means. Yeah. Sooner mended. Yeah. Yep. I always have so many words.
I know. Do you ever do the thing where you type out the words, but then you're like, no, and then you back them all out? Sometimes just writing it out makes you feel a little bit better.
Absolutely. It is the best therapy there is.
Yep. Well, and the thing that we always find, especially if it's a situation where we're in the wrong and or we're not in the wrong, but we're just trying to kind of...
Which is not often.
Not often at all.
Yeah.
But sometimes you have to apologize for things, even when it's not necessarily your fault, just to kind of, extend the olive branch.
Well, the other thing that you do so most excellent, I may add, that I need to work on myself is when we've got a situation and we're a little heated, you just say, we'll deal with it tomorrow. I need to sleep on it.
Yeah.
Very wise.
Yes. That's what I try.
Try.
It's taken me a few years to get here, but
I shall maybe never come to that.
Well, I'll be here to guide you.
Oh, God.
I know. All right. Well, that's enough of you today. So peace out, Girl Scouts.
Have a good day.